our mean age was 33. Most of the people who enrolled were between the ages of 15 and 44. Our oldest, according to the sample, was 61. And most of them reported not having any prior experience with mental health training. And so something else that we should point out is most people who enrolled were also identifying as people of color. Only 10% identified as white. And in addition to English, we had 11 different other languages that were spoken and represented, which is great. And we looked at the effectiveness of this peer mental health program, which what we called a quasi-experimental design, meaning there's no control group. It's all voluntary sample of people who volunteered for the program. But we were able to look at the pre-test before they had the training, then the post-test right after they had the training, and then 6 months. So we just had our 6-month post-test. And some of the variables that we looked at were things like their self-efficacy. How comfortable were they talking about mental health before the training and then after the training? How comfortable or confident do they feel in helping people find resources and care that they needed? What was their intention? After this training, what was their intention? And if they talked to someone who needed help, would they refer them to those resources? What were their perceived effectiveness in terms of the training? How have they applied this in their lives, and how engaged have they kept with our program? So after our first year, we actually had 93% of the people who had gone through the training that 93% who registered for the training completed the training. And so we had 27 from our English cohort and 28 from our Spanish cohort. 100% of them were able to demonstrate that they had mastered the content through the quizzes of a score of 90% or higher. And after taking the training, navigators reported having less embarrassment or feelings of shame and stigma around mental health. And that was statistically significant. This slide, you probably won't be able to read all of it, but was really fascinating because I thought that people who volunteered would come to this program with maybe having a little bit more experience or more confidence around these things, and we wouldn't see a significant difference. But we did. We did see a significant difference in these variables. So one of the things that was also unexpected was that we also just thought, well, they're taking this training, they're probably more likely to seek help for themselves. But we still saw that after the training, it was a statistically significant difference in their own feelings about seeking help, which was really, really interesting. Sorry about that. We got disconnected, but the other thing we wanted to do is in 6 months, we wanted to see how many people have they referred, how many conversations have they had, and in hopes that they've had at least more than one conversation. And we were able to see that most had, the majority of them had between 3 to 6 conversations or referred them to care. So we are going to do some testing again at 12 months and see if those numbers increase. We also had some qualitative data that we looked at, and some of the themes that emerged were, the Peer Mental Health Navigators largely really liked the format and felt that it was effective and felt that they were being able to use it in their everyday lives. So I won't bore you with this, but if you're interested, you could have access to these slides and see a little bit more of some of the qualitative information. I think what stood out that was really heartening to see is just how in their everyday lives and their conversations, whether it was talking to someone whose child was having difficulties at school, or being able to, as one person said, explore their own biases and unlearn maybe things that they had learned that were negative about mental health. Another person talked about being able to help a friend that had a niece who tried to commit suicide. So all of these were just some, everyday examples of how they were applying what they've been learning. So in summary, there's a high demand for this type of model. Our program has actually been invited by an organization called the Hope Foundation in Bangladesh to share this model with them and to travel there. And they will be working with midwives, and they'll be adapting this for their clinic. They're working with women who are in their perinatal who are expecting in perinatal phase. So they're going to be adapting this largely for expectant mothers or expectant people, I should say, and addressing mental health in that stage of their lives. We were able to surpass our goals. We ended up training 55 rather than 40. We have additional funding. We connected more than 227 people to resources and to care. And that's not to say that we don't have things to do. One of the things that came out of this program is the engagement by youth. There's just such a large demand, especially from 13 to 18-year-olds to get involved. So we created a youth advisory committee with some of the youth that had gone through the training, and we're trying to build on that. Right now, we're conducting some focus groups, but we've called those youth circles, where youth from all different parts of the counties and in different backgrounds can talk to us about what their perceptions are, what their lived experiences are around mental health, and offer some ideas for what are the strategies that might work best for youth. So what's next for us? We are continuing to grow. We are connecting with not just different organizations, but growing what we call our BIPOC provider network. It's to reflect the diversity of the communities that we serve. So connecting those providers with whom many of our community members are not able to connect, make them, help them be available for conversations, but also for private practice as well. We would love to recruit more people who identify as male or as non-binary to be part of our Peer Navigator Circle, continuing to grow our youth focus. And then at the end of the year, we're going to be having a mental health arts festival. So that's where you can come in as well. If you've created any art or poetry or videos, we welcome you to participate in this event, even from a virtual way. So you can learn more about our program by going to mentalhealthmatterswa.com. And I look forward to seeing the work that you put together this quarter. Please feel to reach out. You can reach me at jearly3@uw.edu. And one of the things that some of the messages that we're trying to get across are things like mental health is health. Mental health is not just mental illness. We should be able to talk about mental health, breaking the silence, breaking the stigma, and also the message that you're not alone, that people are not alone, that there is help available, and there are people that will listen and that will care. So feel free to use some of those themes in your work. And I look forward to reading and to watching what you put together. And so happy that we had this opportunity to connect this quarter. So take care, everybody.